important topic that we all need to have increased awareness around. And I think you're absolutely right that voices like yours need to be at that table from the beginning to make sure that your voices are heard in terms of planning, and that this is, this is an issue of equity and an issue of fairness, right? And I think you put that very eloquently. Thank you very much for bringing your voice here tonight. It's really, really important.
Thanks. I'm really glad to be here.
I'm glad to have you. Thank you. Pause on that for a moment, and I'd like to move on to our final panelist of the evening, Dr. Daniel Bierstone. He is a pediatric resident. He's in his final year of training at the Children's Hospital of Eastern Ontario here in Ottawa. He obtained his medical degree at the University of Toronto. He has a special interest in healthy childhood development, Indigenous child health, and newcomer health. He's a resident leader at his clinics, and Daniel is a member of the Canadian Paediatric Society and the Canadian Association of Physicians for the Environment. He's written op-eds on the importance of climate action for children's health, and he lives in Ottawa with his wife, who's finishing her family medicine residency, and their 3 young children. Welcome, Dr. Bierstone.
Thank you, Sarah. It's strange being part of the panel without seeing the audience, but welcome everybody. I'm so happy. I am so happy you've all joined us tonight. As someone working in pediatrics, of course, many of my perspectives are similar to those that Dr. Guns has shared. I do think the 3 most concrete challenges climate change is posing to children are exacerbation of, I guess, asthma triggers, essentially, the risks of heat-related illnesses, and also Lyme disease. So I thought I would elaborate a little bit on Lyme disease because that's a story that's actually unique to my area, Ottawa. And just to mention, when I graduated medical school only a few years ago, maybe I spaced out during that lecture, I don't think I ever learned what Lyme disease was. It wasn't really taught as much of a thing, and especially in the Toronto area. And I only learned what it was in residency. Lyme disease basically is a bacterial illness transmitted by a certain tick species, a certain type of tick, that can cause a range of severity of illness, ranging from a mild rash with fever and just feeling unwell and a bit of sore joints, to more severe systemic manifestations where you might have paralysis of part of your face, or inflammation affecting your heart, causing heart block or meningitis, and the most severe manifestations, this kind of arthritis picture. And the reason Lyme disease is so connected to climate change is because the rates of Lyme disease have dramatically increased in the Ottawa area as a direct result of climate change. I was hoping to actually share a slide. Is that possible, Sarah? To share my screen? Yeah, I think so. Yes, 1 second. If I can find it. Here it is. This is a table or a figure that was presented at the Canadian Pediatric Society in 2019, authored by one of my co-residents, actually, good friends, and one of the infectious disease doctors at CHEO, where I work, showing the trends of Lyme disease in Eastern Ontario in the Ottawa area. So specifically in 2009, we had 0 cases of Lyme disease in children, whereas in 2018, the last year on this figure, we had 13. The peak year was 2017 for some reason. And the reason we have this trend is because a longer warm season, because of climate change, has expanded the geographic range of a certain type of tick that carries this bacteria. And to me, and of course, I've seen Lyme disease cases here at CHEO, and to me, that's one of the most concrete examples of how the warming climate, of how so much of human health is dependent on that interaction between humans and the natural world, and how a warming climate is expanding the range of diseases carried by factors in the natural world. It's such a poignant message because COVID is another example of a extremely virulent and harmful pathogen that is causing the harm it's causing because of our interactions with the natural world and how they are being mismanaged effectively. The second part of the question was how to mitigate risks of climate change. Of course, the answer is not to go outside. There are some very practical measures parents should take to mitigate the risks of Lyme disease, such as checking your kids' bodies after being out in the woods. If there is a tick there, removing it in a specific way by the head, keeping it in a container. If one thinks that the tick was there for 24 hours or so, or if it seems important to go to a doctor. But that's one example of a disease that's been really accentuated in my area because of climate change. The other thing I would add, especially to the discussion surrounding asthma and heat-related illnesses, is just to what degree this disproportionately affects kids or families who are already underserved. As Andrea said, it's nice to move away from using the word vulnerable, but people who are marginalized, people, especially family who are racialized families or families who live in low-income neighborhoods, cramped housing, less access to natural space, to green space, to air conditioning, accentuates the risk of asthma exacerbation, heat-related illnesses. And that's just one example of many where climate change amplifies existing social inequities. As a final point, I think it's also important to realize how much climate change is affecting Indigenous communities. Here in Ottawa, we have the privilege of providing medical care to much of the Inuit population in Nunavut, and as part of providing medical care, we do quite a bit of cultural sensitivity training as well, and learning about the unique issues facing many of our families from up north. And climate change is altering hunting and fishing and living off the land that many Indigenous communities depend on, both for their both for livelihood and also for cultural and spiritual ties. And so that's just another example of how climate change affects health and well-being in such a more holistic and overarching way than health effects per se. Okay. So Sarah, I think I'll hand it back to you for the next.
Thank you so much for bringing up those really, really relevant issues that I think each of us can identify with, and also to increasing our awareness around issues of those, as you say, most affected by these repeating crises and multiplying crises. And I think the other point I wanted to thank you for bringing up too was the connection that COVID-19 has with climate change, and I think that's often missed. I think people are often thinking, climate change is one issue and COVID-19 is a separate, but in fact, as you mentioned, they're very much intertwined, and without action, we're going to be looking at a future of recurrent pandemics. So thank you very much for bringing so many excellent points forward. We do have a question and answer